na yung poster natin right now is actually about no weight gain December. Kasi if you notice, we are already nearing our December. It is considered as the most awaited month of the year when it comes to eating, feasting, at kung ano-ano pang mga gatherings. We are already ending our last day of ADF challenge or alternate day fasting for the month of November. So for those of you who joined, thank you so much for joining and congratulations for taking that very important step towards your health. So for those na sumali for our November challenge, let me know kung ano yung mga benefits nyo for other group members of Life Without Rice and at the same time low carb feasting and fasting community. Marami nang nag-weight loss, marami na ding iba hindi nag-weight loss but lumiit yung tiyan. So it is important for us to know na hindi lang weight yung basihan ng ating benefits and at the same time gains from this way of life. And so before we move on to December, tomorrow December 1 na, first day of December na. I think we are, for those who've been in intermittent fasting for so long, I'm sure alam nyo how beneficial it is already. Pero sa mga iba dyan na hindi pa rin ganun ka-familiar with this way of life, para sa iba, medyo mahirap magsimula. So last year, if for those of you who have been following me already for almost a year, you will know actually na last 2019 of December, I posted a series of tips and tricks every day for the whole month of December na entitled na sinabi nating No Weight Gain December. So I will lift the file. Tingnan natin if we can see it, but I think it's already online. It is available lang in my Instagram account and at the same time in my page. If you are watching this via Global TV Network, I will be sharing this as well sa page natin. And in my page, actually, meron akong isang album dyan na No Weight Gain December. Hello, Miss Eleanor. Thank you so much for watching. Tita Karen, Doc Fee. Hello. Thank you so much for watching. I hope you are enjoying there. And tingnan natin. So, and if you've seen our planned, proposed na schedule natin, kasi nung November, we did ADF or alternate day fasting. One day eating, the next day fasting, and then eating, except on Sundays wherein most of us feast. But for those in UAE, I think sa mga kapatid natin in the Middle East, they were feasting on Friday and Saturday. Parang yun kasi yung weekend nila. Kasi yung off duty ng mga ng UAE in the Middle East is mostly on Fridays. Hindi tulad sa atin na yung weekends talaga natin is Saturday and Sunday. So, but for the rest, I think many of us were feasting every Sunday. And so, we feasted last day. And today, for some of you, you may opt to continue fasting to complete your ADF, or you can already feast or celebrate today. As for me, I already ate, I think, a quarter chicken. 2 quarter chickens ba yung naubos ko? Pero I think 2 quarter chickens, so that is already half chicken. Pero hindi ako masyadong kumain ng laman. More on the skin side at saka yung mga juicy part lang. Hello, Doc Fee. Yes, I'm so glad na nakahabol ka. And of course, Sir Norwin Crespo of Global TV Network. As always, thank you so much for making this initiative, making this platform so that we can reach as many people as possible. So, nakita nyo ba yung natin? Do you have any questions with regards to our schedule? Hello, Chloe, my dear. I'm so glad na nakaabot ka. And early work today, early work off. I hope the weather there is not getting too cold for you, or I hope na kumikik in na yung autophagy and at the same time increase metabolism for you to increase your heat production. So I'm sure makakaya lang yan. So I would like to greet each and everyone who are here with me. Thank you so much. Hello, Fadhila Malian. Maraming salamat for tuning in. Let me check. I think nilagay natin doon. We have this no weight gain No weight gain December challenge. That was already last year. Oh, is it here? Oh, I think it's in our group. So for those of you na member ng ating low carb feasting and fasting community, we have a group there and we have photos there. And we have albums. So, nasa na yung albums kaya natin? So, we have albums. And we can check there yung mga pictures natin. So, doon, we have different tips and tricks. Mostly, it is catered for those na hindi pa talaga. Yung parang, yung wala talagang alam when it comes to IF and at the same time, low carb. So, simple rules lang actually. For us, for those of you whom I know, no, na alam kong medyo veteran na talaga, little simple tips and tricks like this no longer matter or somewhat hindi na natin appreciate. But actually, for the majority of the public, kasi meron tayong what we call bias. We have this bias because we have been in this way of life for so long na akala natin minsan eto na yung norm. But actually, when you go out, especially when you are not always in our groups, you will realize that you are somewhat very, very far talaga from many other people. So, little tips and tricks like ending your meal, last meal of the day, before 6 p.m. or before 7 p.m. Alam nyo ba na for others, that is already considered as parang effort na. Hello po, Mystica. Need ko po tumaba. So, if you want to gain more weight, I suggest you gain weight not by fats, but by muscles. So, how do you do that? We have a schedule. You can increase your food intake every 3 hours in a window period, still with fasting, that is 6 to 8 hours, and then you can eat at least 30 grams of proteins every 3 hours. Kasi yun lang yung limit ng protein absorption ng katawan natin. So that you can maximize and at the same time, you are inducing muscle building. And it will be of more benefit and the effect would be faster if you pair it up with some exercise. Not necessarily rigorous exercise if bago pa lang. But if you're already used to doing exercise, you can do high intensity interval training. That is just 4 minutes to up to 20 minutes maximum per day. No more than 30 minutes if you must. But it is already proven to be a good exercise for your heart and at the same time muscle building. So hello Ayeng, thank you so much for watching. Christina Lianes de Leon, Doc, please inform me how to treat high blood pressure with my husband, 48 years old. So is this a new onset hypertension? Kasi if this is a new onset hypertension, and how high? Kasi we have cut off, we have hypertension stage 1 and stage 2. Stage 2 hypertension is usually more than 160 to more than 120 yung SBP and DBP, yung systolic and diastolic blood pressure. But for lower than that, that is 140 to 159 and 90 to 100, yon, that is considered as stage 1 hypertension. It is considered as noon, when I was still not very familiar with low carb and fasting, I already considered hypertension as a lifetime disease. Kapag nagka-hypertension ka, parang ano na yon, curse na yon, that you'll be hypertensive all your life. But knowing what we know now, as what we always say, we've seen people with chronic hypertension for more than 5 years, for more than 10 years, and even some with 2 or 3 or even 4 medications, and yet we were able to reverse that. We've had guests before. We have Cherise, we have Tita Army Benedicto, we also have Attorney Mel, we have a lot. Even Sir Alan Cura, if you've been watching before, hello po. Yes, 180, 100, so that is quite high. Sometimes that is the first incident, parang mako-consider niyan as malignant hypertension, meaning it is a medical emergency that kung hindi lang maganda yung kondisyon ng katawan ng husband mo, knowing na it's not really in the best condition, given na tumaas na ganyan yung blood pressure niya, it can even be worse. It can be, the first manifestation could be heart attack, could be stroke to certain people. But at least naagapan, it was only an elevated blood pressure. Maybe may dinamdam siya. maybe hindi familiar yung katawan niya to high blood pressure. So maybe it is a new onset. And as what I always say, try to look at what you did the last few weeks, the last few months. Was there an increased food intake? Specifically, increased carbohydrate intake, not just sweets, not just soft drinks, hindi lang desserts, kundi pati rice, bread. And also, was there decreased in physical activity as compared to the previous level of physical activity? So, yun, from those recipe, decreased physical activity as compared sa nakasanayan, and at the same time, increased in food intake. So, sumobra yung food intake, specifically with carbohydrate intake. It is a bad combination of a possibly lowering your metabolism and increasing your fat storage and increasing your fluid retention, and at the same time increasing inflammation sa katawan natin, which can manifest in as any possibilities. Pwede siyang maging diabetes, pwede maging hypertension, just like what happened to your husband. And so what to do? You try to recall first what he did, kung anong nangyari the last few weeks, the last few months, and try to change. So I invited you already to our Life Without Rice group. So that is a group intended to help those who would like to start a low carbohydrate lifestyle. So we made the name Life Without Rice. Hindi lang talaga actually rice yung ini-eliminate natin. We are actually eliminating, most importantly, sugar. Most importantly, yung mga processed foods na carbo-loaded, desserts, no? If you want desserts, there is a lot of recipe out there, mga very kind and generous nating mga members dyan who are giving away their recipes, even if they have their own business on low carb, they are giving it away for free so that all of us, sa lahat ng members ng group, can benefit, can still enjoy life. So, you can start by eliminating your carbohydrates. For sure, merong carbohydrate source na kinakain yung husband mo. Is it, for most Filipinos, it's rice. For others, it's bread. For some naman, it's sweets. Okay? So, nandun, parang yun yung at may pangapat pa, starchy vegetables. So, yung iba, hindi kumakain ng mga matatamis, hindi kumakain ng rice, hindi kumakain ng mga tinapay, pero grabe, kalakas kumain ng mga starchy fruits and vegetables tulad ng saging, mga lamang lupa, mga root crops like cassava, kamote, potato, so all those. Try to eliminate that, and then slowly, you can start with intermittent fasting. So, it's basically like that, but we are talking about this right now, specifically in preparation for December. Kasi yung fasting, it's something that we do on a day-to-day basis. It just differs on the length, no? Sometimes mataas, more than 20 hours, 22. Ako ngayon, I think I've fasted for 21 hours. Kasi last night, I ended my meal at 6:30, and kaninang 3:30 p.m. I took my first bite of that fried chicken na very fresh, very crispy, very juicy, na ako talagang nagluto. Okay? So, I did a 21-hour fast right now. And after that, I also do low carb. So far, wala pa akong nakain carbohydrate except for the minimal breading that I used in my chicken. So, before we proceed, I would like to say hi sa mga very, very loyal and happy people who are here right now. Elizabeth Lucas II, Mystica, Maria May, Principe Naag, Tita Karen, of course, my dear. Miss Christina, I hope that helps. But if hindi pa rin, we have a lot of... Feel free to message me and watch the YouTube videos that I made. Meron tayo dyan, beginner's guide in intermittent fasting, and at the same time, low carb lifestyle, how to go about it. Kasi yung pinaka-importante for those who are dependent on rice is the rice alternative. But actually, Filipino foods is actually low carb when it comes to ulam. So, the adobo, the pinakbet, the bagnet, tapa, yung mga silog natin, actually, they're all really low carb. They're good sources of unadulterated, good source of fats, especially if you use coconut oil for cooking. Very good talaga. But what we need to do is to find a replacement for rice. And mind you, yung paghahanap ng replacement sa rice is just psychological. Hindi siya necessary because at what we always say, rice and carbohydrates is not essential. Pwede tayong mabuhay kahit walang rice at carbohydrates, okay? But if you must, so naghahanap tayo ng parang replacement. So binibigay natin usually yung tawag natin cruciferous vegetables tulad ng broccoli, cauliflower, certain mga pechay, bok choy, cabbage. These are actually cruciferous na malaman sa water, but sobrang konting-konti lang yung calorie content nila at marami yung fiber. So they're actually good. However, meron din tayong mga warning minsan, especially when it comes to cabbage. Tita Army, if you remember, yung guest natin around a few weeks ago, she actually worked for Department of Agriculture. And alam niya na for this cabbage to grow full bloom, yung bilog na very clean and very mataba and very green, before they can grow into this, they have to be bombarded with pesticides. So, as much as possible, don't depend everything on cabbage. Eat still in moderation, maybe 3-4 cups per meal lang, and wash them thoroughly, and you can cook them as well. Para at least yung mga kung ano-anong mga preservatives and pesticides and nitrites that are eventually can do damage when accumulated, especially if you're fasting short fast, not really long fast, they can still accumulate. So those are things that we need to consider. But for those naman na hindi talaga naghahanap ng rice, like myself, I actually don't look for rice replacement anymore. But it turns out, yung nangyayari lang, dumadami yung ulam ko. Like as what I told you a while ago, I just ate 2 quarter chicken. So 2 quarter chicken, so that's actually half a chicken. So yun, but wala akong rice, walang anything. So that's how I eat nowadays. And then I added pa, I think I ate another piece of fish fillet. So yun, parang sobrang malaman siya. But when you are used to it, you are no longer looking for rice. Even shirataki rice, it's good, it's filling, and it's low calorie. But again, kapag hindi ka na naghanap ng rice, you're not missing anything talaga. Maria Teresa Judith, yeah, ask away. Yes, please do ask if you have other questions. Si Chloe, Maria Teresa, ano yan? Kasi si Chloe, I think, just came in with her annual physical exam and at the same time laboratory results, and I think it was good. No, more on physical and health talaga yung improvement with Chloe. But I think Chloe, naging guest natin siya together with Charisse a couple of weeks ago. Weeks pa lang para Chloe, no? Kasi yung months, parang friendship pa lang natin yon. So, a couple of weeks ago, around a year na on IF, but very short IF, and low carb. But now, since we've met last September, yung yung fasting, the fasting side was, we focused on that and we improved on that, and you saw the benefits yourself. So the stall in weight, the scale eventually moved again, and more importantly, nag-lose na yung mga damit mo. So hindi lang siya basta on weight. Sometimes kasi, for those of you who are afraid that you are not losing any more weight, don't be, especially kapag matagal na kayo in this way of life. Eventually, your body will hold on to that weight, but it's no longer because of fats, but it will be more on muscle mass and at the same time water retention, but it's no longer fats, okay? So you have to know which one is that, and still you have to be careful of what you are eating. Kaya our no weight gain December challenge is actually more on for beginners and not really for mga veteran IF and low carbers na matagal na sa way of life na ito at wala na talagang masyadong taba na iwawala, and especially if you are already in the stage of muscle buildings, because when you are muscle building, you will actually tend to weigh more because muscle you will look leaner, mas manipis kang tingnan, but you will weigh heavier. So don't be discouraged with that. Know that this challenge, the no weight gain December, is specifically intended for beginners, and at the same time for those kahit hindi pa beginners but still has a lot of fats to lose, okay? Specific fat loss tayo. Kasi if you are already muscular, especially yung mga tulad ni Sir Norwin na bodybuilder yan, na no? So, hindi na yan. And also, Ryan Poncardas, who's also always watching us, yung sinasabi nating very muscular, very lean body mass with 0 to very minimal fat content, parang athletic talaga yung body composition, they don't benefit from weight loss actually, okay? So, we have to read some of your true weight is not the only gauge. Do blood test. Yes. Hello, Miss Ara. Hello po. Thank you so much for watching. How about brown and red rice? So, I think brown and red rice, we've been discussing that in our Life Without Rice group. So, yung sinasabi natin, white rice will shoot up your insulin right then and there. Brown rice, red rice will not shoot up your insulin right then and there, but it will still shoot up. It will just delay. But the overall insulin effect later on, the summative insulin effect will just be the same. So, it is not, sabi natin, not all carbs are created equals. Yes, so if you compare them, medyo lesser evil yung rice na brown, red as compared to white, but only by around 1 or 2 points in 100. So it's very negligible. They're somewhat the same. You might as well do away with that. And it might scare you, but actually, most of us who are into low carb and intermittent fasting lifestyle for so long, ay yung pinaka go-to replacement namin ay itlog. Walang bahay ng LCIF practitioner na walang itlog. We each have our own egg supplier. Right now hinahanap ko pa yung consistent egg supplier ko na organic eggs kasi yung brown eggs yun talaga yung mas maganda, mas mainam. Kaya lang I think it's getting somewhat popular kaya nauubusan na din in our locality, but I'm still trying to look for that. So, pwede po bang magtanong? Yes, pag tanong mo pa lang yan, nagtatanong ka na. So, yes, ano pa ang next mo na tanong? Just ask away. And then, Elizabeth Lucas, you're welcome po. Thank you very much for watching. I would like to look for that. Or I think it is in my Instagram account ba yun? We have that. So, if you have been with me, yes, brown egg, Eleanor. Maganda yung brown egg talaga. So, we have, marami tayong mga tips and tricks. But for those of you who are already in this way of life, even longer than I did, because for me, diba, I told you, my fasting anniversary is February. Although I've been fasting since 2018, but my extended fast, that is a more than 4 days fast, was February 2019, and so mag to 2 years pa lang ako with this way of life. So for those of you who are in this way of life longer, try to share your known tips and tricks so that others can benefit as well. So we have this no weight gain December. Meron tayong if you will check my ito yung natin, no weight gain December, no? So yan. Yes, egg, ilang tray per bahay? Ha, oo, ang dami-dami ng tray, but I give away my trays to our supplier para ma-recycle nila. So the last one here is tip number 31. So this is the last day already. So we can check for our day 1 para alam natin kung ano yung tip number 1 natin. That would coincide for tomorrow, for example. So tip number 1 of 31, eat your dinner 1 hour earlier. Okay, so given na yan. So what do you do? So for example, if I eat my usual dinner at 6 p.m., so with this tip, I can move it to 5 p.m. Okay? No weight gain December. Tip number 2, have breakfast after 9. Okay? So, sino pa ba sa atin ang nagbe-breakfast before 9? Ako, I think I cannot remember anymore the last time I ate breakfast before 9. It's usually 12. Earliest siguro 11 if merong occasion. But mostly, it's 12 to 1 o'clock. And usually, na-maximize ko ang 12 noon if I've been on extended fast. But if on daily fast, I usually eat my breakfast at 2 p.m., 3 p.m., just like kanina. We also have no canned or bottled drinks. So I think even LCIF practitioners can still benefit from this, because I know some of us are still drinking mga zero calorie soft drinks and sweetened drinks na processed. So maybe we can still do away with at least this one. So no canned or bottled drinks. And the best way to do it is actually to sum it up. What you did on the first day, like moving your dinner 1 hour earlier, and then the next day moving your breakfast later, and then you can continue that. And then on the next day, no more canned or bottled drinks, and then starting from that day onwards, wala na din. So we also have skip rice in at least one meal. So good thing, I'm sure a lot of you are already skipping rice. So if you are already skipping rice, but if you're still think you are taking something that you are not supposedly eating, for me, ano ba yung pinaka-cheat ko siguro? Kasi hindi ako super strict talaga ng keto, low carb lang. So maybe I can skip yung condiments na soy sauce, kasi nagso-soy sauce pa rin ako from time to time, especially yung mga seasoning. So maybe I can skip that. And then number 5, consume 2 to 3 servings of ulam and 2 glasses of water first, okay? Before you eat other carbohydrates, in the form of sugar, in the form of starch, in the form of rice. Okay? Hello, Connie. Thank you so much for watching. Si Doc Fee, sabi niya, my tray goes to my vermis. Wow, walang sayang. They love to eat egg trays also. Oh, nagbe-vermiculture ka pala, Doc. Galing-galing naman. Sir Dudes, kamusta na po? Hello, Doc. Ilang itlog ba dapat kainin per day? I'm taking atorvastatin. Wala tayong sinasabing dapat kainin, because as I said, hindi siya dapat kainin. We have options on what we can eat. So, egg is one of those foods that we can eat. But as to how much you need to eat, wala tayong ganyang level, okay? Because the nutrients from eggs, you can also get from nutrients from other meats, especially innards, offal, yung mga laman loob. Yes, you can still eat from there, liver, yung mga ganon. So, it's not a matter of how much you have to eat, but we don't put limit then, as long as you don't eat it together with carbohydrates, because if you do eat it without carbohydrates, you will go into appetite correction and you will be having a hard time to overeat. So hopefully what you are eating is just enough for you. Ano daw po ba ang gamot sa CSEAS? Ano ang CSEAS? Hindi ako familiar. Sorry, hindi ako familiar kung ano ang SEAS. Is it Tagalog? Is it English word? Please enlighten me. So, we have, moving on muna. Tip number 6, craving for sweets, drink water and take something salty instead. So, this trick is actually what we call as the salt fix. There's even a book about it. The cure for sweetness, sugar addiction is actually salt. And salt is actually more beneficial than it is harmful. So, sobrang mali yung mga kinalakihan nating idea. Baka cyst? Oh, okay. Cyst, so merong mga tumutubong mga bilog-bilog, no? So, cyst in medical term is a cavity, fluid containing cavity. So, meron siyang loob. For some, it's usually fluid. For some, it could be filled with pus. Pwede siyang, nana. And for some, merong ibang mga kung ano-anong mga particles, kung ano-anong mga fluid forms. So, it can happen anywhere. I think the most common kind of cyst that we talk about is the polycystic ovarian syndrome, or the PCOS, yung cyst na tumutubo sa ating ovaries, because ovaries is one of the highly active organs na very sensitive also to effects of insulin, which is growth hormone like, in properties. So, cyst can occur anywhere. For some, it might not be cyst, but it can be polyps. So, nasal polyps, yung mga polyps sa ilong, mga polyps sa sa GIT, sa kung saan saang parte ng katawan, they are actually a lot more related to our sugar and insulin levels in our body. So if you want to decrease that incident, that risk, much better kapag i-eliminate mo yung intake of carbohydrates. Magiging lowbat na ako. Number 7, whole eggs for breakfast. 8, 1 heavy meal, 2 light meals on a Sunday. So instead of feasting the whole Sunday, you can have 1 heavy meal only and 1 to 2 light meals only. And then you can finish dinner by 7 p.m. or even earlier if you've been following the tip number 1. Reduce sugar to 0 to 50%. So for us, who are already in low carb, so if we are, for example, doing a maximum of 50 gram carbs per day, so we can reduce that to even lower, 0 to 25 grams, para mas maganda yung effect. Water, plain coffee, tea with or without salt for breakfast. Yes, so this one actually, at tip number 11, we are actually slowly introducing some of the basics of intermittent fasting. Na subtle lang in a way na hindi nila, for those who are not knowledgeable about IF, akala nila nagbibigay ka lang ng tip na mag-water, plain coffee, or tea ka lang for breakfast, but actually that is already intermittent fasting. Hi, Doc Grace, reshare your album, No Weight Gain. Nakita niyo po ba? Thank you so much. Buti pa nakita mo. Hello, Lilay ba ang pagka-pronounce? Watching from LA, California. Wow, thank you so much for watching po. We have tip number 12. Take the stairs, park far, or walk the longer route. So we are incorporating mobility here. If you are not doing regular exercises, at least do not be shy away from moving. Kahit hindi ka nagkakaroon ng regular exercises, but whenever there's an opportunity for you to do more, to move more, maximize that time because it will still do you good. That can still be a form of exercise, and kung pwede pa lang, you exaggerate your movements because exercise by definition is just a repetitive movements of large muscle groups, okay? So, kung isang ganyan lang, hindi siya exercise. It should be repetitive movement of large muscle groups. So, kapag gumaganon ako, so the large muscle group would be from my arms, so the biceps and the triceps. So, that is what exercise is all about, okay? So, maintain a good posture. It burns fats on the right places more than slouching, okay? So, this is actually a good reminder. So, I will sit straight kasi when you are sitting straight, when you are doing a good sitting position or standing position, you are actually burning more fats, and you are building muscle on the right places. Isn't that nice? So, number 14, be busy in the morning and have brunch after 10 a.m. or even later. Alam na natin yan. Tip number 15, one choice of carb to pair with your main course. Pili ka lang. You can have an only veggies, a cup of rice, 2 slices of bread, half an egg, or nalobat na ako. So, we have to look into that. I think nasa tip number 15 na tayo. So, we can continue since Doc Fee said, she shared already our No Weight Gain December album from 2019, and we can relive that, and then we can make an advanced level. We can share that in our group. So if you are still there, guys, if you have your own tips and tricks na nalalaman nyo with this way of life, feel free to share this to everyone so that we can help each other. Hindi porket mas nauna siya or mas matagal na, ay sila na ang may alam, or ako. I still learn a lot from all of you, and from time to time, I still get amazed sa mga tips and tricks na nagagawa ng mga ng mga members natin. Gamot daw po sa bukol sa dede. So, cyst, so that is a breast mass. So, if breast mass, it is still very, very related to hormones, which is estrogen. At alam nyo ba na ang fats natin, kapag ang tao ay tumataba, the fats na tumataba sa ating katawan, na nasa ating balakang, sa ating puwet, sa ating mga braso, hindi lang sila basta taba. They can sometimes go into a mode of becoming hormonally producing fats. So, instead of taba lang siya, hindi siya normal adipose tissue, it can become an adipose tissue that actually produces estrogen. And these estrogen can induce effects on cells na estrogen sensitive. So, ano ang mga estrogen sensitive cells? So, basically, the reproductive organs of females, uterus, even, ovaries, all those, and yes, including breasts. So, if you lose weight, you are not just mainly losing weight, but you are also reducing the number of fats or adipose tissue, yung mga taba na nagpro-promote ng cyst formation because of its production of estrogen. And this can also happen hindi lang sa mga babae, kahit sa lalaki. That's why meron tayong sinasawag nating feminization of a man. Merong mga lalaki na nagkakaroon ng parang nagkakaroon ng boobs, di ba? Nakita niyo yun? Parang anong tawag doon? In slang words, it's man boob. So, that is actually produced mainly because of too much fats. That is also secreting estrogen. So, kahit lalaki sila, nagkakaroon sila ng estrogen sa katawan that is not supposedly normally there. So that is how bad becoming fat is and becoming insulin resistant. Because as you become more insulin resistant, kapag sanay na ang katawan mo sa daming sugar, tumataas na lang insulin sa katawan mo, but the effect of insulin is not there on the right side, but the accumulative side on the inflammation, on the cyst formation, on the tumor genesis, it is building up. And most importantly, the fat build up then. So yun, yung gamot, it doesn't have easy medicine na makakawala, but it can be surgical at first. As a surgeon, for those of you who might not know, this lifestyle that we promote is only something that I promote as an advocacy. No, but my specialization actually is head and neck surgery. So I do operations. I am a surgeon by profession, and with mass on kapag may mga bukol tulad ng nasa dede, the first thing that you have to do actually is to have that checked up. Baka kailangan i-biopsy so that we will know if it's benign or malignant, if it's cancerous or not cancerous, and then your doctor can take it from there. You can have it excised. And for those of you who want to try, you can also do your own research, and you can see to do some lifestyle change. Give it time. Anyway, with the pandemic, hindi basta-basta, hindi madali ang magpa-opera. So while waiting for your schedule or whatever, why not try to improve your way of life by eliminating all the carbohydrates and even go into fasting if you still have fats to lose, okay? Kapag meron ka pang taba na malulose. But for those na mga elderlies, for example, yung mga nakikita nating kakik siya, yung parang butot balat na talaga na common with tuberculosis patients, also chronic or mga end stage cancer patients and kidney patients yon. So they are not somewhat doable to do prolonged fasting, okay? So hello Vanessa, thank you so much for watching. Ching, very interesting. Ano yan? Watching from Norway. Hello po. Thank you so much for watching. And then, I hope, May, that answers your questions when it comes to the bukol sa dede. Si Je, nandyan na naman, pa-shout out. Syempre, basta ikaw, Je, shout out yan. Thank you so much for watching at buti na lang nakahabol ka. So happy that you are all here. And if you have anything you'd like to share, you can have your own questions, you can have your own tips, you can have your own realizations, or you can share your own journey. Kung ano ba, when did you start this way of life? Who inspired you? Who would you like to thank for most especially? I think marami dito na nanonood is I think maraming na-learn talaga from Sir Dave and Miss Ara of LCIF, no? So, we are very happy that there are those people who pioneered despite the challenges, okay? And I'm so happy to be a part of the family as well. And as for me, I think I posted it a few months ago, no? to give credit to whom the credit is due, I actually just stumbled upon a YouTube video, yung one lazy afternoon, that says, bakit mas mabuti pang mag-fasting ka na wag ka na lang kumain kaysa kumain ka ng konti. And that science behind it, the science behind it made sense, no? Because I personally know a lot of relatives na grabe kumakadayet, yung halos whole life nila kakarampot lang na biscuit yung kinakain, and yet they are not losing weight. They are very weak. They are pero nakikita mo talaga na they are having a hard time losing weight. So that is something that I learned, I stumbled upon last year, and I think it was one of the major twists and turns in my life na somewhat na dumating ako sa where I am now. So sa inyo, who inspired you? Ching, sabi niya, it was my best friend, Annabelle Colina Jaime, who told me about you. Ay, hello po. Thank you so much for sharing. Kasi minsan, hindi ko na ma-keep track yung mga magagandang tao na nagme-message sa akin. But I'm so happy. Kahit, we may not know each other personally, but with the community that we are building, actually, I feel more connected to many of you than my previous public profile sa Facebook, no? I think I feel like you are becoming more of a family and a really close community for me. And I'm so happy that as we all learn from this way of life, and as we help each other, we also add more members, especially the ones that you already know, the ones that you already love. Kasi sayang talaga when this way of life is free, when this is something that is very sustainable and something that can help a lot of us, especially our loved ones. So, ask ko lang if anong low-carb food aside sa egg pwede kainin sa morning taking prednisone. Di na po kasi ako nag-breakfast. First question, bakit ka nagpa-prednisone? Prednisone is a steroid. It's usually given for those with allergies, inflammations, or autoimmune diseases. And these inflammation and autoimmune diseases are actually one of the first major things na nako-correct with low carb and fasting. But if you are still new or weaning from it, eventually I hope you get to wean from your prednisone. If not, for those who are doing IF, we usually say na you can move your intake kasi yung instructions then usually take it for breakfast. But we know that the time for breakfast is relative. Hindi kailangan early morning. Hindi kailangan alas 9, alas 10, or 6 a.m. or 7 a.m. Breakfast is simply the first meal that you take. So if you are doing intermittent fasting, and your first meal, your breakfast would be at 12 noon, then you can take your first medicine, the medicine that you need to take with meals during that time. It doesn't need to be early. I hope that answers your question, okay? And if I didn't follow your page, I'd probably be stuck with 71 kilos. And right now, along kilo ka na, Chloe. Hindi, you never look like 71 kilos to me. Doc Grace, okay lang po ba mag-take ng antibiotic while doing extended fasting? In the first place, why are you taking antibiotics? So if it's for a reason, most likely there is an ongoing infection. For some, it is different. Kasi it will depend on which side of infection. So for example, for abdominal infections like the one undergoing surgery, definitely they are actually fasting kasi cannot tolerate food intake pa yung katawan nila. But for other infection, it's up to you. Only you can tell if makakaya mo. Like for me, for the last almost 2 years, never na ako nakatake ng any medicine, especially antibiotic. I've had allergic rhinitis before, and when you know if meron kang allergic rhinitis sa ilong, meron talaga mga bouts of infection na parang minsan kailangan mong mag-take na antibiotic to decongest your nose. But so far, what I do whenever I feel like I'm going to be sick, and that usually happens when I eat some carbs more than the usual carbohydrates that I am allowed on myself, doon ako parang magkakasakit, and I just counter it with fasting. Nagpa-fast lang ako. After 24 hours, I feel good. I can extend it. Antibiotic for my tooth. Oh, okay. So, antibiotic taken with meals, I I think no, it would be better that you eat it kasi sobrang sakit sa sikmura kapag wala kang tinitake, especially certain antibiotics like clindamycin or coamoxiclav. Medyo mahapdi yan sa tiyan. But if you do eat, yun yung sinasabi natin, always stay low carb. Okay? Have it low carb lang. And as for your tooth, I would like to tell you something about what I recently discovered na hindi ko pa rin na-try, but maybe you want to try with me. Are you familiar with oil pulling? Alam nyo ba yon? Oil as in coconut oil, and then pulling as in push and pull. Are you aware with that? So, oil pulling actually is a traditional practice of toxin removal and at the same time oral hygiene, cleansing of oral cavity, including teeth whitening, practiced by Indians. Meron siyang certain term. Ang procedure niya, kukuha ka ng 1 tablespoon of coconut oil at igagargle mo siya. Ito lang yung catch. Igagargle mo siya ng 20 minutes. After 20 minutes, yung size niya magiging double na at parang nakakadiri siya. But it's actually, theoretically, it is drawing in the toxin. And you do it when you are fasting. Kapag naka 20 hours fast ka na in a day, you do that for 20 minutes. Parang kapag may ginagawa ka, for example, you're checking in your Facebook, you're checking in your computer, you do that, and there is a lot of, like, centuries old na siya, even ilang millennial old practice na siya of certain tribe in India, yung mga Indian, and it's doing them good, but wala pang research about it. So it's said to have been doing good in dental hygiene sa ipin, sa gums na health, and even halitosis, yung bad breath, it can remove that. For those of you na hindi sanay sa coconut oil, don't worry, after you do the 20 seconds, 30 minutes na gargle, you can just do regular toothbrushing with toothpaste and dental flossing if you must, and you will feel very, very clean. Hindi ko pa na-try, but maybe I will try that and I will tell you more about it. But if you want, you can check on it. Oil pulling, it's actually one of the best. Sabi nila, especially when you are doing extended fasting, kasi when you are extended fasting, merong time dyan na parang magkakaroon ng parang merong film like sa tongue mo at saka sa surface ng iyong mouth na para siyang medyo nakakadiri. But with oil pulling, it can help with that and it can cleanse it right away. So, bago po sa padinig ko yung oil pulling. Yeah, ako din. So, but it really sounds promising, especially na ginagamit niya yung favorite oil natin, coconut oil. So, I'm not sure how it will work, but even if there's no good science that can back it up yet, but certainly, wala ring science na nakakapagsabi na masama ito. So, I think it is safe for us to try. Hello, Hello, Kimpoy. Thank you so much for watching. Let me check. Anong oras na ba? What time is it? Oh, so we're almost ending na pala. So, it's already 50 minutes na since we started. So, we have around 10 minutes more before we say goodbye. Watching from Norway, and si Christina, Doc, kapag nagpa-fasting, need po ba mag-meds losartan ng prescribed upon knowing nga po high blood pressure ng husband? So, you have to consult with your doctor because your doctor should know what you need to do, no? So, what we have here is just based on our personal experiences and testimonies from our readers, but iba pa rin yung face-to-face interaction with your trusted medical professional provider. And for those with hypertension, what I always say is keep on monitoring your blood pressure. Kung pwede, twice a day, every day, consistently, on the same time, so that you'll know. And I think your doctor told you na if your blood pressure already, like when you are taking it daily in the morning, but if your blood pressure is already below 100/60, so that is actually going to be low normal. If you take pa anti-blood pressure meds, it can even be lower than that, and you might have a danger of going into hypotension. So you have to consult with that. But for now, I would like to advise you that you should make a blood pressure diary for you to check. I think I saw Kay, my dear friend Kay Benedicto. Thank you so much for watching. Casey Carion, hello Doc, kailan po ba best inumin ang magnesium pag nagfa-fasting? So it's up to you. If you are taking magnesium as part of the snake juice, yun yung tinutunaw at minimix sa isang 2 liters of water. So you can take it like as if you are taking water the whole day. But I'm not fond of doing that kasi very particular ako sa lasa. So kahit sobrang konti lang na imimix mo sa water, alam kong may mix siya. So I like taking water as is, as pure. So I like taking my magnesium at night, okay? Before bedtime when I'm fasting, because magnesium can also, especially magnesium citrate, it can help with sleeping. Meron siyang parang calming effect, nakakapagkalma. Kaya yung ibang magnesium na supplement nga na yung ibang magnesium supplement na brand, meron siyang something about sleep, night na yung pangalan. Kasi nakaka-calm siya. And at the same time, it can help with bowel movement. So, tamang-tama lang yung effect niya overnight. And the next morning, when you have your coffee or your first warm water, parang nakakapag-push siya. So, maganda rin yung bowel movement mo. Yung morning routine mo at the toilet, okay na okay din. So, please like and share mga kasama. Mag-watch party kita. Thank you so much, Kim Poy, for campaigning. Good evening lang sa Glow family. Sir Hola, Tita Marge, Miss Melanie, Miss Pinky, Miss Yen, and Miss Femi, Miss Mai. I think the Glow family is the part of the family of my Tukib Negros family. So, Tukib Negros is a local radio program here in Negros every Sunday. 12 noon. So, I am part of that segment on the Health Watch side. So, I hope you get to listen to that. And, meron pa, ask lang po, anong gamot sa arthritis? Salamat. So, arthritis, specifically rheumatoid arthritis, is just a product of inflammation. As for gamot, you can just ask any other doctor. Most doctors will give you anti-inflammatory medications, yung mga pain relievers. But as for me, since I am a root cause medicine practitioner, I will ask, what are the foods that you are taking? Anong mga pagkain kinakain mo? Are you fond of eating carbohydrates, or even are you fond of eating certain vegetables na mataas sa oxalate content, tulad ng mga mga sobrang mapapait na mga even too much cabbage, too much na mga root crops, at mga certain legumes, mga beans. They can increase oxalate content in your system, and that can accumulate sa mga joints, and it can lead to joint pains. But as to what to do in case you would like to try something else other than just medicine, there is a very good research on that. RA, rheumatoid arthritis, and intermittent fasting. Specifically, meron ding alternate day fasting, alternate day fasting for 1 whole month. Marami nag-improve talaga symptoms-wise, and they no longer need to do medicine. And since I am a root cause practitioner and a functional medicine practitioner, I don't just rely on medicine. I will try to maximize first yung lifestyle modification, improvement of diet and habits. And if hindi talaga kaya or hindi talaga willing mag-go through ng mga process na yon, then of course, I can always prescribe medicine. And that is, we reserve on our actual consultation. But I mind you, this one is not our consultation. This is merely our friendly talk, our friendly FB Live, where we share our own thoughts and experiences without any ulterior motive behind, or any hidden agenda behind. It's just mere of sharing the knowledge that we know, and with a hope that everybody can benefit as well. Okay? Casey Carion, Angela Padilla watching with birthday girl Nanay Gracie Luis Padilla. Hello, Tita Nanay. And Nanay Grace is my brother's mother-in-law. So, Tokaya, same kami ng names. Grace din yung pangalan niya. Happy birthday, one of the most beautiful person in the world. At sobrang ganda rin yung mga creations niya with her hands. from her home, interior design, and even in her garden at sa mga pagkain. We are somewhat sobrang dami naming na-share other than our names. Happy birthday! Happy birthday! I am so happy. I hope I get to spend your birthday. Kaya lang medyo busy din dito. But I know you are enjoying the company of friends and family, and that is more important. So, Rondon Commissar Nor, hi! Thank you so much. So, I think we are already past behind. Okay, we already are running out of time, but I'm so happy that you get to spend time with me for this coming Friday, December 4. We will have another live Q&A. So if you have questions, feel free to get them ready, write them down, and I will answer them. Medyo busy lang for the whole month of December, and hopefully I can have more time to spend with you all starting January. But stay tuned, and please like and share this video, and also share to your loved ones, especially the ones that you trust and the ones who trust you, because it will matter a lot. So maraming salamat po. Thank you so much, Vanessa, for appreciating. I hope you get to have a good week ahead, and stay low carb always, guys, so that we will all stay safe. Bye bye, Connie. Thank you so much. Thank you.